Thanksgiving is around the corner, but one local doctor says that coronavirus may have a seat at your table if the proper precautions aren't in place first. Thank you for joining us for 7 News at 6. I'm Steve Moore.
And I'm Catherine Guyon. Dr. Matthew Coleflesh from Trinity Health System joined Governor Mike DeWine today during his health briefing to prove the harsh reality the Ohio Valley is facing during this wave. 7 News anchor Shelby Davis joins us live now from the newsroom with details from that briefing. Shelby.
Catherine, Dr. Coleflesh says during the original spike in April, the peak number of COVID patients in Trinity Health Systems was 9. Then it continued through the summer. Things started to cool down in Jefferson County. He says they started to increase activity in the community, such as opening the schools. Although they didn't see a spike for a while, now things are different. Coleflesh says in the past 2 weeks, cases have dramatically shot up in Jefferson County, leading to 34 patients hospitalized with COVID-19 and expecting that number to grow again. He noted that sickness always ramps up in the cold weather, and in hospitals, they're used to it. But COVID is a whole different beast. Coleflesh ended his conversation with Governor Mike DeWine saying the reality is they're stressed. He says residents of Jefferson County are fatigued and frustrated with mandates, which is leading to Trinity's worst fear.
The type of patients that are coming to the hospital now are those patients that we worried about all along. We planned for them extensively in April. We went through hours and hours of meetings and logistical planning and everything you could think of to make sure that the patients were well taken care of. We had a disaster plan. We were accepting patients in the southeast part of the state. We were fortunate for that. But I would say as we approach Thanksgiving, the reality is that it has changed.
He says Trinity is short-staffed, which is no stranger to Ohio hospitals. Nurses are limited and cases continue to grow. Coleflesh says the problem, though, isn't the beds. They have enough of those. The real problem is finding staff to help the patients in those beds. So he's reminding Ohioans to hold tight. He understands the holidays may look a bit different, but being different is the best way to keep your